This is a short video to introduce you to our company, Alliance Therapy Services. The company was started in 2010 by our three owners, Rob, Dexter, and Frankie, who are actually all therapists. Rob and Dexter are both physical therapists, and Frankie is our occupational therapist. If you would like to check us out online, visit our website at alliancetxs.com. You'll find more information there about our owners, employees, and what we do on a day-to-day basis. The Alliance Therapy Services office is located in the heart of Beaumont, Texas. Beaumont is located just east of Houston, Texas, and we are also very close to Louisiana. You could actually find yourself there in less than an hour's time. Our coverage areas are shown here, and each therapist that comes is assigned a specific territory. Territories for travelers are subject to change as needed according to vacations or staffing changes, but for the most part, we do try to keep our therapists and our territories consistent. Drive times do vary slightly between territory, but you can figure for between 200 to 400 miles per week with an average of 10 to 20 minute drive times between patients. These calculations are from the time you reach your first patient to the time you end at your last patient. A lot of people do get confused and want to count that initial drive from home and the drive back home as part of that mileage, but this is just the same as a commute to work. I know it does get a little confusing since part of the job is driving, so just want to be sure that it is clear when we state the mileage associated with the job, what that includes. With such large volumes of patients, we are able to keep our therapists in reasonably small territories, and you often may end up with several patients in the same neighborhood. The 10 to 15 minutes is an average, and you often may have patients that are closer together. Our company is branded as a therapy contractor. In essence, we contract physical, occupational, and speech therapy to various home health agencies in our area. We currently contract with close to 30 agencies, and we are completing around 1,000 therapy visits weekly. There's a lot that goes into making sure everything goes smoothly week to week so that we are successfully delivering the best care to each and every patient. The success of our company is due in part to our wonderful ATS office staff. We have an office staff that includes multiple schedulers, HR personnel, receptionists, and admin staff that keep things running as smoothly as possible. The office staff takes care of everything from intake of referrals to invoicing to mapping and scheduling out visits. Our goal is for our therapists to do therapy and, of course, documentation. Of course, you'll be keeping constant open communication with the nursing staff at various agencies, but as far as clerical work or scheduling that can be done by the office to lighten your load, we've got that taken care of. We want to make your job as easy as possible, and our entire office is always there to help out when needed. Those drive times that I mentioned earlier are possible because we have our office staff that are mapping each and every patient so that we can assure that it is being scheduled to the therapist with patients closest to that area. The patient population for our company is strictly geriatric. You won't be seeing any pediatric patients at all. The diagnosis for our patients range from general muscle weakness, hypertension, patients needing help with ADLs, patients with total knee or total hip replacements. Of course, diagnosis for the patients will be available to you in our documentation systems beforehand. Now, to give you a little idea about those documentation systems, we actually utilize two different systems. One is WellSky, which was previously known as Kinzer, and the other is PointCare. We have several agencies that use the PointCare system, so we'll train you on both so that you can see patients for all of our agencies. On your day one orientation, we'll train you on Kinzer and then give you a few days to get a feel for that system before we introduce you to PointCare. So no worries, we won't throw them both at you in one time. We'll give you some time to get used to one before we put you on the other one. Following your Kinzer training on day one, which will take roughly 3 to 4 hours, we'll schedule you 2 to 3 patients so you can get started with patient care. If you're interested in doing a ride-along beforehand, this is something we can discuss in the interview. ATS will also give you basic supplies for the time you're employed with us. You will have a tablet and keyboard with 4G connection so you can do all of your documentation with the patients. We also supply blood pressure cuff, stethoscope, pulse ox, gait belt, goniometer, thermometer, TheraBand, and home exercise programs. The dress code for our company is pretty straightforward. The dress code policy will be given to you on day one, but basically we just ask that you dress professionally. Scrubs or slacks are recommended, flats or tennis shoes. Please avoid sandals or open-toed shoes. Also avoid strong scents, wear minimal jewelry, and no hats. If you're interested in home health or you're just trying to get your feet wet as a new grad, ATS is a great place to start. We're unique in the way that we run, and our goal is to always make your life easier as a therapist. We would love to have you come on board with us and be a part of the ATS team. If this sounds like something you would be interested in, we look forward to talking with you soon.